Hi everyone.
Hello,
Hi
ladies.
Sister Queen. Welcome to another episode of Doctor in Our Life podcast. I am Dr. A. This is Dr. Angie. If you're new here, Doctor in Our Life, we share real stories. Okay. Just real stories.
Yeah, we should
Yeah, we also talk
discuss
about
about
we also
women
discuss about women's health. We like to call it the real, the raw,
and the
and the
medical.
medical. Today we're going to be talking about something very interesting and very
Sensitive,
sensitive.
yeah.
Let me ask you this. Can you imagine a woman trying to get pregnant for years and when she eventually gets pregnant, only for the pregnancy to result in a miscarriage or stillbirth? That's very
Very,
devastating.
very devastating. Very sad
Mm.
also. And there are a lot of expectations when a woman gets pregnant or when she's trying to conceive. She starts to think about what the child will look like, whether it's a boy or a girl, what the name would be, what dresses or clothes they'll buy for the child, and now all of those dreams come crashing. It's a very sad situation that I would not wish on any woman or any parent or a family even. So losing a pregnancy is even for people who do not plan to get pregnant. When they discover that they are pregnant, that excitement, the joy, and
It's not for everyone. Like people that want the pregnancy, not people who are not expecting
some
it.
people are not expecting it,
Yeah.
and but they still feel happy
No,
because
no.
man,
What I mean is people that
people that want to be
no,
pregnant.
they don't want to be. Let's say you're not married,
Okay,
you're
okay,
not
okay,
ready to have
yeah.
a child. Now
Yeah,
you're pregnant. It's not exciting.
that's a different situation. Now we're talking about people that
They
maybe they were not
want,
actively trying to
yeah.
conceive, but
Then,
then they
but
want,
they also want it.
yes.
Yeah.
So for those people too, they also experience that grief,
Yeah.
with losing the baby or the babies. And there's this thing called chemical pregnancy,
Mm.
where you don't even know you're pregnant until you lose the baby. But for some people, they are lucky. Maybe they noticed that their period was 1 or 2 days late and they decided to now check.
And it was
And it was
positive.
positive, only for them to start bleeding after 2 or 3 days.
Mm.
At that point, they may have told their
Husband, okay, I
partners,
think I'm
their
pregnant. It's
family, and
positive. Yeah,
and now they have to
that's
now
really
explain that, oh, it's probably
traumatizing.
my period. But it was a pregnancy
Mm.
that you lost. So
Yeah, I actually
it's
got to know about chemical pregnancy in more patients,
mhm.
and I think I also got to know about it in school, but it wasn't really common. There are just so many new things that just spring up, and you just learn with time. I've not really, I mean, I've never been pregnant before, but I know people very close to me who have tried getting pregnant for years. They've gone to the hospitals, different hospitals. They are both fine. They've tried procedures and it
And
failed.
it felt, yeah.
And doctors just keep encouraging them. And there are people that they've tried. They get pregnant. They're happy. Miscarriage in the first 3 months, and recurrent miscarriages, and just it affects people a whole lot. They are sad, they have to go through therapy, some just give up, some even start to resent their partners. So
And some people even become suicidal at that point,
yes,
especially when it's been recurrent.
yes, people don't even get to, because I know people don't a lot of people don't get to understand what people are married and have given, or who are trying to even have
Conceive.
children. Yes, and people are just really insensitive. Some people are just, when are you people going to have children now? Look at this
They'll say, oh,
person
you're just
now.
enjoying
You are
yourself.
just enjoying yourself, and
Yes.
and you don't really know. And some people just keep mocking you. I used to think that, oh, I mean, we should have grown older. The world should have become more westernized now.
And
So when
wiser.
people are talking,
So,
but still, people are not still sensitive. People will
mm-hmm.
still come and still, poke it in your face, still talk about pregnancy. They don't know that you've gone through a lot. Do you know that there are some people saying that there are some women who have never been pregnant? All what they just want is they want to just try. They just don't have that feeling of being pregnant, even if it will still result in a miscarriage.
I know a certain woman that told me that she just wants to get pregnant,
So she will say she has
even
never been
if
barren. So she will say she's not barren, rather.
this one, it's sad because she wants to get pregnant so that she can prove to her mother-in-law that her son did not marry a man. Like when she said it to me, I just got tired. Like I didn't even know where to start from with encouraging her because we had done all the tests. She's fine, her husband is fine. So at this point, we don't know what to say to them other than, oh, just keep trying,
You know
right?
that there are some women too, especially when it comes to the early pregnancy loss, maybe the one that occurs in the first 3 months. A lot of women blame it on themselves. They'll
Themselves,
be
yeah.
like, oh, our body is not fit enough to carry pregnancy, or she feels like, oh, there is something wrong with her. And then she just starts to say, oh, maybe because I didn't take folic acid, maybe because, I didn't do well, or maybe,
Some even become very
yeah.
religious about it.
Yes, say spiritual
Yeah.
attack, and and maybe the food they ate, and let's
Or
talk
some
about.
people even say that on the day they got married, that there was a particular person that maybe touched them or hugged them, and that's probably why they're not pregnant.
On a spiritual attack today.
But
But
like I'm just saying, a lot of
yeah, so,
reasons
so
that
let's talk
people give
about causes,
themselves.
reasons why some women could actually experience early pregnancy loss, especially in the first
First
trimester.
trimester. Yeah, for most pregnancies that end in the first trimester, they are caused by chromosomal abnormalities. So chromosomes are a stack of genes. So if there is a mismatch, a loss, maybe chromosome number 9 went missing, or chromosome number 11 duplicated, or became more than it should, or there's a cut or something. So because of that deformity, the the pregnancy just ends, and
So
then the
it can
person
be from
starts
both
bleeding.
the man or either the woman, or
Well,
both.
it's like the two, the man and the woman, they're coming together, so it could be from either the man or the woman.
You know that.
Especially when, sorry
Yeah.
to cut you, especially when they are older, like the woman is maybe in her 40s or late 30s, and the man is also in his late 40s or his late 50s. By the time you're getting older, your eggs and your sperm quality also depreciates, so can have all of that.
I don't know if you've seen this ad before. You're looking for sperm donors. If you are between 17 to 21, they'll give you 1.4 million.
Okay.
25 to like 30, maybe like 800.
Uh-uh.
30 to 35, maybe like 500. Above 40, 100.
Well, that's not nice, but again, it makes sense
Yeah, and
because
that's because
as you're getting older, the
and
quality of your
they used to
sperm and your
say it
egg
before.
goes
Women used
down.
to blame themselves because they used to just be like, "Oh, it's the woman's fault.
Yeah.
She has married, and she's getting married in her 30s, and now she's losing babies. That's because the quality of her eggs. At 20s we are prime, and then that's when she should have quickly, gotten pregnant.
Gotten
And all.
pregnant.
But now new research is actually saying, oh, it's really,
The same for
yeah, the
both the
quality of
man
the
and the
man's sperm
woman.
too could also cause the pregnancy. I'm sure
Contributes.
men will not like that kind of stuff.
I don't think anybody would like that. So that's the first reason. Then the second one could be that the cervix, which is the mouth of the womb, it could be incompetent. That means it's open. It's meant to be closed so that the pregnancy would stay inside the womb. So if at the early stages of your pregnancy, the cervix
Something like that. I mean, she has lost through pregnancy due to cervical
incompetent, okay.
incompetence. And I know that there are people who are going through worse. She got to know, she's educated, she found out, through doctor. But there are women, let's say in underserved regions, and they just keep losing pregnancies and
Yeah.
they tie it to, oh, she's a witch, she's eating her children, a spiritual attack,
Yeah.
or something. And they don't know. Many women get pregnant, they don't go to hospital. The number of women who do not go for antenatal
Quite
are way more than people
there are
who
so
go for
many.
there
There
are
are
way
so
more than
many
people who go for.
antenatal
There was
care.
this thing I saw when I was still doing my house job. This They came with, the woman was bleeding. Apparently, she had lost the pregnancy, obviously, but she went to this traditional birth attendant,
Oh,
and she was in pains. I didn't know what they were doing for her, but they were not doing anything.
anything serious?
So
Oh,
when they had to rush her to the hospital, she had lost so much blood. I think her PCV was like 10% or so.
That's
Then
quite low.
yes, and honestly, I still remember this thing well because I saw a mother beside her holding a nylon bag, black nylon bag,
Containing.
twins, dead fetuses.
Oh, that's that's
And
that's that's
they've never gone to the hospital. They've never, they've of course, if they've not gone to the hospital, we do antenatal. They get pregnant, they start going to, church, or they start going to the Ile Alagbo, that's the traditional birth
better
attendant.
than
Some
okay.
traditional birth attendants, in a way, they
Some
may
of
be
them are actually
skilled,
skilled, yeah,
but
but most are
most
not.
of them are not.
Mm-hmm.
So that's one thing. So that's also, a leading cause of
Of yes,
pregnancy loss.
pregnancy loss, and then because they don't know that they have an incompetent cervix, they
Yeah.
cannot even have the procedure done to close it up, because if you don't know what the problem is, you cannot solve it. And another cause that is common as well is when your progesterone levels are low.
Yeah.
Because progesterone is the hormone that helps to sustain the pregnancy, to keep it growing. And so if your progesterone levels are low, the baby cannot develop further, and then you lose the baby. There is also the part of physical abuse. When you're punching your wife, your girlfriend, and you now hit the part and induce early miscarriage, that could also happen.
You were
Right.
mentioning something where we there about a woman with a particular syndrome.
Yes, the antiphospholipid syndrome. I don't think I've seen any case that is as hurtful as that, because this woman had a condition in which her body was rejecting her babies. So most of her miscarriages were happening in the second trimester. So from the time she comes for antenatal care, which is probably maybe the first time she misses her period or second time she misses her period, we place her on bed rest. And each time she gets into like week 22, week 21, she starts having the low abdominal cramps. And mind you, she's on a cocktail of medicines. She's taking a whole lot. We are not allowing her to lift a needle. But each time she will lose those babies. And there was this one that happened. She had a twin gestation, so she was carrying twins, and we were very hopeful. Her pregnancy was getting to 25, 26, so we're already
Hopeful.
preparing for, delivery. We're all excited, only for her to enter into spontaneous, would I call it labor? I don't know what to call that. She just started having this intense cramping.
Contraction.
She was bleeding. She was screaming, like, the hurt. Even her husband fell to the ground on the ward and started crying. He was sobbing. And mind you, this woman had stayed in the ward from the beginning of that pregnancy to that point. So just think about the cost of the ward space, the medications that she was taking, her not working, and the man bearing the bills. I don't even know how they were able to survive that.
And I think there's psychotherapy we do. I think some hospitals do this after the loss of a child.
So, yes.
They come talk to the mother, the social department or anything. But then some people are not trained to do that. Some people are still not sensitive, when talking to the mother. So, there is also the part of, letting the mother grieve, then slowly trying to, enter her life and see how you can help. Since most first trimester pregnancies are caused by chromosomal abnormalities, why is genetic testing not a common thing here in Nigeria?
To be honest, I really don't know. Because I was thinking that because chromosomal abnormalities are a very significant cause of miscarriages, we should be testing, the pregnancy at the early stages. But again, our people are averse to some of these things. So they'll say, oh, why do you want to do that?
And it's expensive.
Yeah, very expensive actually. And there are very, very few centers in Nigeria where they are done. But I think it's something that we should explore. It's something that, because if someone is having recurrent miscarriages because of a defect in their genes, they can make better choices. They can decide to maybe go for an egg donor or a sperm donor, or even adopt, or go for an IVF actually. Because when you don't know that, again, there's a problem, you can't solve it.
you remember the story of one woman that trended one time like this? You know the
No.
story. She was pregnant. She was in a rural area. I think maybe she lost the baby. That she was
Okay, the
watching.
woman in Abuja. I think she was in
Yeah.
Abuja, yes.
What was really her story? I didn't fully get it.
To be honest, I think she was having um I think she was supposed to deliver or something, and she didn't have the money
Oh.
to pay. I guess it was a high risk pregnancy. I'm not really exactly sure about the details now, but she didn't have the money to pay. And someone will say, "Oh, you've been pregnant for a while. You've been pregnant for 7 months, 8 months." But then we disregard the economic realities of these things, because again, stillbirths, even if you were pregnant for 35 weeks and you lose the baby, you're still going to deliver that child.
Mm.
Labor will be induced. So imagine going through the process of labor and giving birth to a dead child.
Mm.
I don't really know how that woman did it, because I think she had twins or something. She was carrying
There was
twins.
this story
Yeah.
of this lady that she shared it like on Instagram. She was pregnant with triplets.
Hmm.
And she was about to deliver them. I don't think it was 10, but it should be like 35, 36. She said she was in labor for 3 days in the hospital. And they wanted her to deliver that baby via vaginal delivery.
Most stillbirths actually
No, the
vaginal
babies
deliveries.
were fine. The triplets were
They were fine.
yes, but she was in
Triplets
labor.
are already
They're already
high
high
risk.
risk. They wanted her to give birth to baby naturally. So by the time maybe they eventually took her for CS or so, the
Maybe
babies
they
were
were
gone.
dead. Ah.
So she was, I mean, that story trended. It was still last month. It was
I
really.
actually didn't see that, because I don't, to be honest, like losing a baby is devastating. Now losing
Devastating.
3 babies at once, I don't know how to describe that magnitude of loss, but it won't be easy on the family.
So, what advice do you think we can give to mothers, grieving moms who have actually tried, who have lost the baby?
I would say grieve, because that is a whole child that you lost.
Mm-hmm.
So don't try to dismiss that pain, because the more you try to numb the pain, the more it keeps springing up.
Yeah.
And it can also make you decide not to try, again to give birth, or even to ask questions about why this thing keeps happening to you. Here in Nigeria, we really do not dwell so much on preconception care, but it's something that we need to start, talking about more often.
Preconception care in what?
Preconception care is basically the care, or what you do before you start trying to conceive. So with your partner, you go to see a doctor, and then they assess the both of you. So they'll try to find out if there are any risk factors in maybe yourself or your partner that could make you to have maybe any miscarriages or issues with pregnancy, childbearing, and all of that. Because if we start talking a lot about preconception care, I think a lot of centers will start doing the genetic testing thing. And even these supplements that women are meant to take, the folic acid and calcium and all of that, more women will start taking them, because folate deficiency, or not even eating the right foods, would make it difficult for you to have a healthy baby. And if your body is constantly rejecting pregnancies, it means that there's a problem that you need to address. Sometimes it could even be malnutrition. That's the problem. You don't have enough nutrients. So the baby does not even have anything to, babies are parasites. So the baby does not even have anything to, use from your own body to grow. And also malnutrition is also a leading cause of that. So, and then if a woman is grieving, she also needs support from her partner, from her family, from her in-laws, from her friends. When you hear that a friend had a miscarriage, that is actually not the time to give them space. I think you can give support. You may not voice it out, but if they tell you, "Oh, we lost our baby, we're trying for," even if it's just a couple of months, you can go visit them, sit with them, hear them talk about, the pregnancy, what their hopes were, what their expectations were, those kind of things.
Yeah.
It helps them to heal. If they like to maybe go hiking, you can just suggest that, "Oh, let's go hiking, let's go out to nature, let's go on a vacation, let's take your mind off this. And then, of course, you tell them you should see a doctor with your husband or your fiancé or your boyfriend, so that if there is anything that needs to be addressed, it will be addressed, especially as regards to the family history.
Yeah.
Yeah. And if it's something medical, like you're having low progesterone levels, or you need more support during your pregnancy, the doctors now know that, oh, you have this history of losing your pregnancies, maybe in the first or second trimesters, you're a high risk woman, and you need to be monitored closely. And if you also live with comorbidities like hypertension, diabetes, asthma, sickle cell disease, anything that could make you at risk of, having some of these miscarriages, I think is something that you should do after having a miscarriage.
Saying this, there are people, a lot of people are actually well informed who watch this, and then they might learn a thing or two. My own fear is for people who don't have access to this kind of information, who always feel, for women who always feel like they are the problem and they don't know what to do. They've lost several pregnancies. They feel they are cursed. Meanwhile, the reason might just be something that going to a hospital can solve. And it's really not, I won't say it's not their fault, but they don't have the money, they are not empowered. So they don't even have access to the right information.
True.
They don't have access to the right care. They might even be with very wicked mother-in-laws who hate them, who make their life miserable. And any small thing, they take them to churches. They beat some women. They beat the so-called witches out. They take them to
That's really bad now.
traditional birth attendants. So my fear is really, as much as people who watch this will learn a thing or two, or they might even know, it's still people. How can we still reach people? And the other served area that I'm talking about, I'm not saying one village. It can even be Lagos Highland here. Because most of the cases there, most of them they go to traditional birth attendants. So how can we reach these people? How can we, just tell them, okay, once you know you're pregnant, you missed your period, come. Don't go, just come, let's do a free screening, let's link you up to a hospital. So that's really what I've been thinking about while you were mentioning this.
I think we can meet them where they are, the markets. There are these booths that people set up to check for blood pressure. So if we can also introduce that, in the market settings, we can talk to them about preconception care. Oh, are you having a miscarriage? Especially if we're meeting women.
Women are so
a lot of women
embarrassed to
having
talk
that.
about it. But if one woman stands up and talk, and then the way we also present ourselves,
yes.
that we are not here to judge, we are here to help you. Just come meet us. Just even put anonymous, just put your number. I feel more women will open up.
We can even have a unit in maybe the church or the mosque, where if you have a health challenge, go there. If it's hypertension, it's sorted. If it's miscarriages, it's sorted. Even the primary health centers. The funny thing is, people actually go to PHCs, but if they keep going to PHCs and they're not getting medicines, no doctor or nurses available, after a while they stop going, because to them it's a waste of time. So if we get doctors and nurses, other health workers in primary health centers, it would help, because when they go there, they'll see someone that knows what they are doing to speak to. Otherwise, they'll go to the traditional birth attendant or the chemist, and they probably will not know what to do for them. Another thing that causes miscarriages here in Nigeria is fibroids. Urinary tract infections that are not treated. Dehydration is a very, very big cause of that. And even malaria when it becomes severe in pregnancy. So some of these minor things that we disregard, right? If women do not have the right information, they cannot take care of themselves. For example, if you see a woman that has fibroids, they are huge, they are multiple, and they're already affecting her when she's not yet pregnant. You'll be able to advise her that, if you're planning to get pregnant, you may want to get some treatment for these fibroids, because during pregnancy, the hormones that help the pregnancy to grow would make the fibroids to get bigger. And a lot of complications can develop and you lose the baby. So if you're a woman and you've lost your babies, maybe in the early weeks of your pregnancy, or even at the later stages when you're already planning for delivery, you're not alone. Don't beat yourself up. There are a lot of things that might have happened at that point. So make sure you seek care, medical care, and be kind to yourself.
Yeah.
Be kind to yourself. We hope that you did learn something from
Yeah.
today's episode, and we're with you. You can send us your questions or messages in our DMs, and we'll be very pleased to respond to them. So subscribe.
Stay healthy, stay fabulous, keep doctoring your life.
And subscribe.
to
Yes,
our channel,
like it also.
like, share
Comment.
to your friends, send your comments.
Yes.
Thank you so much for watching.
Catch you on the next episode. Bye.